Welcome back to the Connected podcast. In this special series, we step into the world of healthcare leadership through the voices of advanced practitioners working on the front line. From community clinics to acute care, these conversations explore what leadership looks like in real practice, messy, meaningful, and always evolving. In this episode, we sit down with Lindsay Hurcombe to explore the vital themes of motivation and wellbeing in healthcare leadership. Drawing on her extensive leadership experience, Lindsay reflects on the emotional demands of the role and the strategies she uses to support both herself and her team through high-pressure environments. So, a very warm welcome to you, Lindsay.
Thank you.
Thrilled to have Lindsay with us this morning. Lindsay, do you just want to introduce yourself to our listeners?
Yeah, hi everyone. So I'm Lindsay. I work in general practice. I've been a qualified nurse for 6 years now, and I'm on the advanced practice programme. So I'm coming up to halfway through my master's.
Fantastic. And I'm really thrilled to be talking to you this morning, Lindsay, because I know that juggling study and work and life is incredibly challenging. So I know that you're going to have some fantastic insights for us. But just to start, with juggling all of these things, how on earth do you stay motivated in your many roles?
Well, I'm not going to lie, it is a challenge because I think when you have many plates spinning, it is definitely a balancing act. So from a work perspective, because I work in general practice, I think the environment helps to keep me motivated at work. I think we're in a really fortunate position where we build lasting relationships with our patients, with their families, and that goes across the lifespan. And quite often we can have children and grandparents of the same family in our service. So I think that, yeah, we're in a really fortunate position to have that opportunity. I haven't always worked in general practice, and I think that was probably the one thing that I missed the most when I stepped outside of it. You lose that part of the patient's journey. But I also think, on a personal level, it's education and development for me as well. I think that although it's tough, and as you say, there's many plates spinning, I feel that sometimes if I get too stagnant, I notice that my motivation drops. So that's probably why I'm on this journey of continuous development, because it keeps me engaged, it keeps me going. It doesn't mean it's easy.
Yeah. Brilliant. And I think it's so important, isn't it, to recognise what individually works for you. And if you're somebody who loves that kind of challenge of constant learning and you thrive on that, and you know that's what kind of keeps you energised, then yeah, the advanced practitioner path is probably the right one for you. So, you know, again, juggling all of those things and stepping into those different roles, we can appreciate you know, the joy within our roles, and then the complexities and the challenge. Obviously for us as healthcare professionals, it's not always a smooth journey. We've got lots of responsibilities, and sometimes things are really tough at work. So I'm just wondering what strategies you have that you use that support your well-being for yourself and perhaps your wider team, to make sure that actually you look after yourselves as well as looking after everybody else and your patients.
So this is something that I've probably had to really focus on in the last probably 3 to 4 months, especially because when you go module to module, when you are working, when you have life outside of work, that can be really challenging to manage. And actually, I think what I was finding is you look after everyone else, but you forget to look after yourself. And that can be a real challenge. But I also think part of that is getting to know yourself and knowing what you need. So for me, it's taking your breaks at work. It's taking those periods of regular annual leave. It's doing your best to put in those boundaries to maintain that kind of balance. As an individual, I'm probably a bit of a planner, a bit of an organizer. So I do try and structure my time, particularly with study, because I think it helps me stay boundaried. In terms of the team, we we encourage all of the same things. It's a good idea sometimes to reflect on your day before you go home, because actually then you leave work at work. That doesn't mean it always happens. We're human, aren't we? And we always go home and chew over those situations. Did I do enough? Did I say the right thing? Could I have done something different? But again, that's part of our reflective practice as individuals. And in a way, those strategies make us better as professionals. Team wise, one of the things that we've implemented this year is a lunchtime walk. So it sounds very simple. It takes around 6 or 7 minutes to walk around our village. And what we tend to do is in our lunch breaks, we gather as many people together as we can, and we go out and take those 6, 7 minutes together. Sometimes we talk about nothing, sometimes we talk about work, sometimes we share other things. But actually, what we've all noticed is the improvement we feel in the afternoons. That 6 or 7 minutes of our day helps to reinvigorate, remotivate, and actually it brings us together as a team.
That's amazing. And what a fantastic little initiative. And I say little, but actually it's one of these, things that we say, this is a little thing, but actually it has a really big impact. And you'll know from doing the module with me, Lindsay, that I'm a big believer in the power of the ripple, and that ripple effect of, what are then the bigger and wider impacts from doing that one thing. That sounds really incredible. And as you say, like the difference that it's making to the afternoon. And I wonder what difference then, that makes to your patients, because of the difference it makes to you guys.
So, because we are a rural general practice in West Norfolk, it's actually, I think initially, if our patients saw us together, they were like, oh goodness, is everything okay? Why are you all together? But actually, I think it's a positive image, because we have those conversations about health, about well-being, about lifestyle and exercise and all of those things. They're actually seeing us engaging in that as well. So when we talk about that, they're not thinking that we sit there and recommend something. They know that we're getting out and doing that too. And I think that probably makes a difference and makes those conversations more meaningful with the patients.
Yeah, it's definitely a really lovely way to role model that advice, isn't it? And practice what you preach, if you like.
Yeah.
So, that sounds super positive, and obviously that's really, really helping you and your team, which is fantastic. But I wonder if you can think of a time when perhaps motivation was really low, and tell us how you kind of managed your way through that.
So I think it's probably fair to say we're probably at that point now. We know obviously there's a lot in the media about NHS pay, how that doesn't often roll into general practice. So for people who aren't primary care workforce, they may not know that we don't get automatic pay uplifts because we're not agenda for change. So that can be kind of really, it's difficult to manage in those situations. But I think what we try to do is continue motivating ourselves as teams, listening, creating that safe space where we can have those conversations, knowing that. And I think that's probably what we've really tried to do, is bring ourselves together as a team, because it helps, I think, individuals to feel valued when they're listened to. But even when you're kind of in that position of leadership and you're trying to motivate others, I'm just the same in that sense as everybody else. I also feel the same. So it's knowing that in the team, I've got those people that will listen to me. And it doesn't mean that I don't have the same feelings or the same concerns or the same issues that they're having. So yeah, we try and sort of group together and have those conversations to keep going.
And it sounds like a very, very human way of kind of responding, and being very kind of honest about those feelings, and
Yeah.
communicating and connecting with kind of your wider team. And I think it's always challenging, isn't it, when your professional identity is so strong, as who you are and what you do, but you're perhaps slightly apart from kind of the majority in your work kind of place, and contractual obligations and what have you. So yeah, so the same rules don't always apply, which, you know, sometimes probably works in your favor, and obviously at other times not so much. So again, it sounds like kind of the emotion of being human plays a big part there. So I'm just wondering what role compassion really plays in leadership for you.
I think compassion is really important in leadership, and probably what I try to do with our teams is almost, I say, a culture of safety. And if I say that we use significant events to build that culture, people might think, well, that's interesting. You're using negative experiences. But actually, we use those in a positive way. We recognize that we're all human. We recognize that actually we don't live in a perfect world, and healthcare is not a perfect situation. And unfortunately, there are times when things go wrong. It could be work pressures or many things. But actually, by using our significant events in a positive way, we create that culture of openness, of honesty, of transparency, and actually using that to look at what and why did things go wrong, but actually how can we improve on those, and creating that, again, that safe space where people can feel that actually I don't have to hide and I don't have to shy away from things, because these things happen. So we kind of use things like that to do that, but again, it's that, I suppose, that kind of safety, that feeling that we can be open, we can be honest, we can be transparent, is really important to how we operate within our team.
Yeah, it definitely sounds as though there are opportunities to really grow that kind of team and strengthen the team's kind of ability to kind of work together by, you know, communicating through difficult events as well. And within your team, obviously, you're probably in the advantage position, I guess, that you know your team really well, and perhaps have less of a revolving door than some kind of departments, and, you know, a smaller team, I suspect, than a lot of kind of more acute trust kind of shift workers and things like that. I'm just wondering then what signs that you maybe look for to indicate if one of your team members might be struggling, and how you kind of respond to that.
I think probably, as you mentioned, exactly that. We are a relatively small team, so we do know each other very well. And I think that probably does make that process easier. It also makes that process easier to have those conversations. You have a bit more luxury of one-on-one time. Um, but when you work with people on a regular basis, you get to know how they operate, you get to know what makes them tick, and it's quite easy to see if they are a bit disengaged, a bit less enthusiastic. And probably then we do, I would say, in that situation, regular check-ins, so that, how are you? You know, what's going on? What can we do to make it better? And we have implemented some change for a particular member of staff recently who was struggling a little bit. So we made some adjustment to her clinic times and her day. And actually, a simple change, it can make all the difference to an individual. And actually, but again, it comes back to that they feel that they can say, they don't feel that, well, I can't talk to her about it because she's not going to care. It's, again, it comes back to that safe space, that open communication, and being able to simply say, how are you? Because sometimes those words can make all the difference because they know you're listening.
Yeah, and it sounds that actually there's something very kind of integral to who you are as a person that allows you to kind of portray those values. And I'm just wondering, Lindsay, within those sort of wider teams and those bigger kind of maybe acute trusts and, you know, other places that your fellow kind of nurses might work, where they might work, what, I guess, what strategies or personal values do you think really help you as a leader that could be transferable to those kind of situations?
I think think sometimes it's simple. Communication is probably at the heart of everything we do, isn't it? The heart of everything we do well, the heart of everything we do wrong sometimes. So again, even in those situations, those wider areas, that communication, however big or small, will always remain important. You don't have to be in a position of leadership to say to someone, "You don't seem yourself today. Is there anything you want to talk about?" Any one of us can do that. What comes out of that may be something completely different, but we all have the ability to check in on other people to see that they're okay. We're all spinning lots of plates and we're all assuming everyone can just, carry on and do it, but it's tough, isn't it? So I think, yeah, I think for sometimes maybe that comes back a bit back to personal values, as you say. um, but again, would we want someone to say to us, "You don't seem yourself, is there anything you want to talk about?" So I think yeah, that's it for me.
Yeah, I think that's a guiding principle there, isn't there? As kind of do to others what you want done to yourself, in terms of, those
Absolutely.
checking in and that care. And so, again, with that kind of thought around kind of organizational culture and different leadership styles, we know obviously that they're going to have an effect on staff well-being and perhaps that team cohesion as well. But is there anything from kind of your experience that you feel really does affect staff well-being?
I suppose in terms of leadership, if we consider everyone to be the same, then we're probably going to come unstuck a little bit. A phrase I use all the time, and I probably didn't realise I used it so much until recently, is "we're all different and we're meant to be." And I think probably what I've learned over time is recognising those individual differences and actually what that then means to you and your team, because everybody brings something different to the table. And if you can harness all of those to create your team, yeah, I think that's what makes it work.
Yeah. And it's that stronger together, isn't it? And those differences
Absolutely.
are become our superpowers when we utilize
Yeah,
them in the right way and
yeah,
empower our different members of staff, thinking about, their what aligns to their personal values and their interests and the direction of
yeah.
travel that they want to go in. Yeah, that all sounds very much like it resonates with kind of my experience in clinical practice as well. And obviously, as a speech language therapist, then yeah, I'm very much a firm believer that communication is definitely at the heart of what we're doing. And I loved what you
Mhm.
said about it being, often the right, but also can be the root of what's maybe gone wrong as well. Because I think that can be so true. So what habits or boundaries do you really try to maintain over time to help you kind of keep your well-being in a good place, and keep topping up when you can feel the tank running empty?
Yeah.
Do you have set habits or particular things that you do?
So I think this is something that I've had to think about recently because I think, as I mentioned earlier, sometimes we look to support others so much that we forget to set those boundaries for ourselves. We forget to do those things. And I think probably earlier this year, after going module to module, after having some challenging things in the workplace, probably what I was doing was pouring all of my energy into the team, into my studies. And actually then when you start to notice those sort of signs of burnout creeping in, it's that actually I need to look after myself because I can't look after anyone else if I'm not doing that. um, I always take regular annual leave breaks because I know for me that's what I need to do. A piece of advice I was given, which has been really helpful, is to reflect on your day before you go home, which is something I mentioned earlier. Um, Being realistic with myself, because life is a challenge and we have a finite amount of time to do everything. So, but also I swim because I find swimming helps process my thoughts sometimes. And I do push myself to go if I don't feel like it because I know I'll feel better for it. But also taking time out for the things that you enjoy outside of your job, reading that book or practicing some mindfulness or finding, and engaging with a social network of like-minded people. I think in this situation it's different for everyone, but those are the sort of things that I try and do to help look after myself.
Yeah, some really, really great concrete examples there that, people perhaps can think, oh, actually, I haven't thought about that. I'll give that a try. Or, you know what, you're right. I do that regularly, and it does make a real big difference. It's amazing, isn't it? Sometimes doing that kind of repetitive activity, running, swimming, just walking,
Mhm.
how that allows you to kind of decompress and re-regulate.
Yeah,
And often I find it's sometimes for people it's the drive home, isn't it, where you just like mulling things over, and suddenly that thought will spark or an idea, and either you just feel better for having that sort of space and time to decompress, or it might be
yeah,
the next big project. So
yeah,
yeah, I think you're absolutely right. Taking that time out is really really important. And I think sometimes it's remembering, isn't it, that we don't have to be, we're not aiming for perfection with lots of these things. It's just, trying to be consistent, and
yeah,
I always feel like it's a real privilege to do the roles that we do, but we have to acknowledge that we are human, we're not robots, and
yeah.
it comes at a cost, doesn't it, if we don't look after ourselves, a cost to our, obviously ourselves and our families, but also to the, essentially to the patients that we're caring for at the end of the day.
Absolutely.
And what difference does it make to you, do you feel like, in terms of your, I guess, perhaps your levels of kind of patience, or your level of being able to stop and reflect before having to jump in with particular problems, when you're feeling that actually you've taken that time out? I think, time for regular breaks for annual leave is such a good tip, and one that I have to say I'm going to have to take on board myself, because that can be, if you don't plan it in, it just doesn't happen sometimes, because things keep creeping in the diary. So I think that's a really good tip.
I think probably sort of reflecting on things. Sorry, I've completely forgotten what you asked me first then, actually.
I was just going to say, like, with what difference do you think it makes to you in terms of how you lead the team and respond to your patients when you're feeling, I guess, that your tank is full.
I think to go away and take that time for self-care, that annual leave, it definitely helps to reinvigorate. And because I think we all get tired, and when we get tired, we notice that actually things are not as easy. Things seem much more difficult. A day may feel more challenging, whereas if you'd had that period of annual leave, or you've taken that time for yourself, you may have dealt with that in a different way. So I think for me, that was part of getting to know myself. Part of what I learned on the Milo module, if I'm honest. As well, it's really important to understand you and yourself, because that will then roll out into the team as well. So, yeah, I think it makes an absolute difference, because it more patient, more compassionate. You just need to be able to take that time for self-care.
Yeah, and it's so interesting, isn't it? Because the Milo module, so that's our managing yourself and leading others module. Um, it's amazing how we can, have these really pretty big roles at work, and be juggling all of these things, and just never really take the time to think about, actually, how do we manage ourselves when things get tough? How do we, ensure that we are our best selves as best we can be for the majority of the time? And
Yeah.
how then does that influence, and what impact does that have on others? So, I'm just wondering then, Lindsay, with all of this wisdom that we've been gathering over the last, however many years, what advice would you give to new leaders, or, developing leaders? Because I think, we're all in, on a leadership journey, no matter our kind of our roles, and how many years we've been working. But what advice would you give them about staying kind of grounded, maybe true to yourself, and emotionally well in those kind of, high pressure environments, which I believe kind of healthcare is all the time a pretty high pressure environment.
Yeah, absolutely. It completely is. And I think it doesn't matter what environment you work in, it's always high pressured. Demand for services is always high. And I don't see that getting any better. So I think you're right. We have to have those strategies to manage ourselves. So I think it probably comes back to the things that we've been talking about. We've been talking about practicing self-care. So really engaging with that for yourself. It sounds simple, but making time for you, because actually it does make a difference, not just to yourself, but to your team, to your patients. Staying connected to your values, I think, as well, is really important. Remembering why you do what you do, because everyone has a reason, everyone has a why, I think, as to why we're in this job, why we do it every day. So never forget what brought you here in the first place. Sharing the load. Don't try and do everything yourself. A lot of people have probably been through that, myself included. Oh, it's just easier if I do it. No, it's not. Share it out with your team. And actually, that's probably a really good way of engaging with your teams, because you're bringing them in with you. And I think we probably have to accept that, learning takes place. Leadership can be imperfect. Day-to-days can be imperfect, but also it's probably recognizing that at the same time we don't live in a perfect world. So actually it's then how we learn and develop and grow.
Fantastic. I really, really love the whole kind of holding on to the why, because we started with the why, didn't we? We got into this, we got into these roles because of the why. So I think that's something really lovely, like, to keep hold of and keep going back to when those times get tough. Lindsay, it's been so brilliant to speak to you today, and thank you for giving us sharing so many insights and giving us so many examples and strategies. I'm sure that listeners will find them really helpful, and I wish you all the very best as you continue your studies with advanced practice.
Thank you.
Thank you for listening to the Connected podcast. If you enjoyed this episode, please check out the rest of our healthcare leadership series and stay connected.